Hello, it's the bariatric biologist here. I want to do a little bit of a video explaining my surgery day to describe it quite detailedly to you. So if you're not interested in hearing that, then I would skip this one because I think this one's going to be quite long. So prepare yourself for quite a long video. I found watching ones that described someone's experience with their surgery, like kind of what happened in the day, quite useful and reassuring. I think your imagination can run away with you if you haven't got an idea what's going to happen. Now, of course, every surgeon is different, every hospital is different, and every person's experience is different. So you have to bear that in mind. But the more different accounts you hear, the more of an idea you might have about what's going to be happening. So I wanted to do that. Now, I think I looked better straight after my surgery than I do right now. So I promise I'll look better for my next video. I just came home earlier today from hospital and I've not sorted this out. Couldn't be bothered. So I look dreadful. Great. Anyway, I've got notes on my lap for all the things I want to say, so if you keep seeing me looking down, that's where I'm looking. So I got up really early on the morning of my surgery. I actually got up at 4 AM because I had so many things I wanted to get done. So very early start. And the first thing I did was actually weigh myself because I had this own personal set goal. It wasn't a goal I had to achieve, of losing a stone prior to my surgery. And I weighed myself and I'd lost 13.2 pounds. And a stone is 14 pounds. I was 0.8 pounds away from losing that stone. So annoying. I'm calling that a win. It's close enough. So on the morning of my surgery, I weighed 229.8 pounds, which is 16 stone, 6 pounds-ish. I'll put in the description below what my high weight was so you can see up to surgery day, which is the 1st of April, what I'd weighed. Okay. I also took some pictures that I can use later on for some comparison, so I've got some pictures of my surgery day. I wasn't really taking pictures at my highest weight, not pictures like that, so I'm going to have to start regularly doing those pictures to see if you can see a difference between surgery weight me and hopefully much, much lighter weight me as I carry on the journey. And then I had a shower, which is something we were asked to do to make sure that we were really, really clean, so I had a very, very thorough shower. And shaved myself all over because it had been winter. It was like a forest. It was terrible and it took ages of shaving and I missed huge clumps. I don't even know how I missed them, but I did. I missed huge clumps. Oh. After that, ready to leave. We left here at about 6:30 in the morning because we needed to be at the hospital at 7:15. It's only a 20-minute drive, but we wanted to be safe rather than sorry, but we did arrive really early. And even though we were meant to be there at 7:15, they didn't really let us up in the lift until about 7:30. So we were waiting for quite a long time, but that was fine and I wasn't nervous at this point at all, so didn't mind the wait. And then they showed me and my husband to my private room, which was pretty nice. It had like a wet room in it, a nice bay window. It was quite a nice room. I almost thought I should have videoed it for you so you could have seen it, but if you're not getting surgery with my doctor in my hospital, then that's not helpful to you. And to let you know anything about that, I was having surgery done at Ashstead Hospital, if you know the UK at all, because it's quite close to my house, and I was doing it through the Ramsay group because they're cheaper than other groups, and I was having the surgery with somebody called Mr. Urukula. In the UK, once doctors reach a high surgery level, they change from being doctor to Mr. again, which is funny because you see women like Mr. Elizabeth Downey, I don't know, but it's really funny because you start seeing women with Misters on it because surgeons get called Mr. I just found it interesting. So then, while I was in the room, the anaesthetist came to see me and talked me through a few bits about when I go down, we're going to give me this drug. When I'm out of surgery, half of patients need more painkillers, half of the patients are really in a lot of pain, half of the patients experience extreme nausea, and it's like, great. And actually it was the nausea at this time that was worrying me the most, was okay, so half of the patients have extreme nausea. That's wonderful. So we just chatted a few things through with me and then left. then I got into my hospital gown, and I was told that I would be given these paper knickers to wear. I wasn't. I was completely knickerless. So that was great. I didn't have any knickers at all. Wasn't very happy with that. And then the nurse came and put on compression stockings. Compression stockings are these lovely things here, these white things. They're extremely uncomfortable and really dig in. And the idea of these is they're meant to reduce the chances of blood clot because they kind of compress the leg so you don't get deep vein thrombosis. But they're not comfortable, and they were so hard for her to get on me. That wasn't fun. People kept coming in to ask me questions, to fill in forms, like when was the last time you ate, when was the last time you drink? I swear I answered this question so many times. Do you smoke? Are you allergic to anything? Constantly answering the same questions. They didn't warn me that. They said, you're going to be asked the same question all the time. And every time someone came to give me anything or do anything with me, they always checked, what's your name? What's your date of birth? To check that they had the correct patient so they don't make any kind of silly mistakes. Okay, so then I was able to put on my dressing gown and my slippers. And apparently I had to put on slippers because of apparently infection control. I'm not sure how slippers would help with that, but put on my dressing gown and my slippers, and I was walked down. Said goodbye to my husband, gave him a big hug. Now that I start to feel nervous, so I'm with this woman who's not very talkative, who's taking me down. I don't know what she is. Some kind of nurse, assistant. I don't think she was a doctor. And she was taking me down, and I start to feel really, really nervous. And then she puts me on this bed, covers me up with the blanket, and then the anaesthetist comes in, and I'm starting to feel really, really nervous. Like this is where the nerves really hit in. The anaesthetist was amazing. I met him earlier and he seemed just fine, but now he was hilariously funny. He was making jokes all the time, which is starting to really put me at ease. And then he put a cannula in my hand. He did it really well, actually. Had a few cannulas and this was done really nicely. And he said that was really going to hurt going in, and it didn't. So he put that in, and then he said he was going to give me a drug that would relax me. And he gave me that drug, and suddenly all my nerves were gone. It was like the emotion just disappeared. I even tried to think about it and tried to make myself nervous to see if I could. I couldn't. And I remember saying that to him, thinking, that is so weird. I'm not at all nervous anymore. And he's like, that's the point. And they get me up again, and I have to move to the next door room and lie down in another bed. And I feel a bit weird and a bit dizzy because of whatever drug he gave me that relaxed me. And then I assume he gives me another drug. I don't know, because I don't remember anything else. I don't remember having a gas mask put on my face. I don't remember counting down. I don't remember anything more whatsoever. And the first thing I remember is starting to come round gradually in the recovery room. If you can hear noises in the background, it's my cat. She's trying to get food out of this automatic food dispenser. So she's kind of whacking it. So that noise, if you can hear it, I don't know that you can, is my cat. And if you hear a bell ringing, she's got a bell on her neck as well. So it's my cat. So I'm gradually coming around in the recovery room, and I can feel myself kind of coming in and out of consciousness. And I could feel this band on my arm inflating, and they're taking my blood pressure. And I can feel something weird going on with my legs as well. It feels like there's blood pressure bands across my legs. And I'm not quite sure whether I'm imagining that or not. And then gradually I realise, okay, no. At regular intervals, either one of my legs, something is like swelling on them and compressing them, and that's something that they put on you during surgery and after surgery to again prevent DVT. So it's kind of squeezing your legs to try and make sure that your blood keeps moving to reduce the chances of a blood clot in your leg. So that was interesting. And as I come round, gradually the pain increases, and the lady who was looking after me, who was lovely, quite enjoyed chatting to her. I don't really remember what we were talking about anymore, but was constantly asking about kind of your pain level, getting you to rank your pain out of 10. And my pain, as I was becoming more and more conscious, was getting higher and higher and higher. So I was like, yeah, my pain is a 9. It's quite high. And it was mainly at this time, it was the drain that was in, because they have this tube coming out of me to drain the blood out of my abdomen. and that it's quite a wide tube that's basically stuck inside your abdomen, and the site at which it comes out was very tugging on your skin. So that was really uncomfortable, and it was mainly that was causing all the pain. So they were then trying to get my pain under control, and gradually giving me more and more drugs to reduce the pain, which were gradually working, and the pain was coming right back down to about 4 or 5. And at that point, they were happy to take me upstairs. But prior to this, I've been asking constantly, it's like, has someone informed my husband that I'm fine, that I'm out of surgery? Because I was more worried about him being like anxious about me, because he was quite anxious. He was far more anxious about the whole thing than I was. And they kept assuring me, yes, we have told your husband that you're out. I'm not sure whether they did, because it sounds like he heard just before I came up. So anyway, they took me up. I went on a really long journey, went into elevators. Wasn't very with it, because I was on loads of morphine and still coming around from the anaesthesia. So don't really know the route. They took me into a room, and it was during this journey that some more pain hit. And this time was gas pain, which was just kind of like this really tight, painful pressure just under my bust line or whole way across. And they're telling me that that's gas pain, and it was very painful. So I was taken into my private room where my husband was, said hello to him, and the pain was just increasing very, very rapidly. So I ended up in quite a bit of pain, and at this point I was saying, it's a 10, it's a 10. No, it's an 11, because it's gone above any pain that I've ever had before, and it's above what I said was a 10 a minute ago. So that was the worst pain I felt the whole time, even till now. That initially taken back to my room, that gas pain was the worst pain. And I remember thinking at the time, okay, is this pain bad enough that you wish you hadn't done this? Because, you know, in the moment, at the worst moment, you can wish you hadn't done something because you just want the pain to stop. And then later on, when you're in less pain, you don't regret it anymore. But I remember thinking during that time, no, this pain is not bad enough for me to regret what I've done. So actually, I think that's really positive, that the worst pain I had didn't make me think, I wish I hadn't had this surgery because this pain is horrible, even while I was in it. And it didn't take them very long to bring it down. I think they were pumping me full of morphine, actually, because when I talked to them the next day, they said, oh no, you seemed like you were in a lot of pain. And I was like, okay. So that's as bad as it got, and I'm quite pleased with that, if that's the worst pain that it got. Okay, I have no idea where I've got to on this list because I've just been talking. They often talk about gas pain being in your shoulders. I haven't had it in my shoulders at all. It's always just been down around my abdomen. It's usually referred pain into your shoulders, and they kept asking me about that. And I was like, no pain in my shoulders whatsoever. So I didn't experience that, even though most people did. But once they got my pain under control, I was in and out a lot. I was so glad I had my audiobooks with me, because there's no way I could have read. Listening to intermittently to an audiobook worked really well as the best thing. My husband was sitting next to me playing games for most of the afternoon, and then he decided to go home at a time when I was feeling quite good. And I continued to feel good, so he left, and I decided to film the video that I showed. The last video that I uploaded was of me soon after surgery, and I was feeling really, really good. But as the evening progressed, the pain got worse again, because I think they were trying to reduce the amount of morphine they gave me. No, I didn't like that, apparently. So yeah, the pain went back up to like an 8, maybe a 9. But it never went back up there again. So once they got it under control after that, my pain never went back up there. So really, really positive. Now every 2 hours they were taking my blood pressure, my temperature, my heart rate, my O2 sats, to check how I was doing every 2 hours, and that was through the night as well, so every 2 hours. And they had to keep doing that drips to give me new drugs, and had me on lots of paracetamol, as well as things like Orimorph, which is oral morphine, and things like that. So I was sleeping, but very intermittently, with people constantly coming and checking on me. Now the problem was I couldn't actually lie on my side at all. It didn't seem to matter what I did, but I couldn't seem to lie on my side, which is the only way I can normally sleep. So actually the fact that I was drifting asleep whilst lying on my back was quite good for me. And I wasn't quite flat because they wanted me slightly propped up. So I did sleep, which was really, really good. And the next day was when the surgeon came and visited me and checked my stomach and all that kind of thing. Still not wearing any knickers. So then he's pulling up my thing and I'm just completely naked for the world to see. But later on the next day they did let me put my own underwear on. And you have no idea how much better I felt just because I was wearing underpants. Like, oh, so weird. But yeah. And from then on I felt pretty good. Eventually they took the drain out, which again allowed me to feel even better, and then I could have a shower, and I washed my hair and I felt really good after that as well. So it all looked up from then on, and now I'm home, the pain isn't too bad. I'm only on cocodamol, effervescent cocodamol, which is what I've got in here, which tastes not very nice. I've got squash in here as well. And cocodamol is paracetamol and codeine together. I can only take small sips of anything. It's slightly annoying. But I'll give you another update of kind of like how my first day at home's gone. But I thought I would show you what my stomach looks like. Okay. So my bra is currently undone because it's easier that way. I'm trying to get it in a position where you can see. Okay, so up here there's an incision. This is what makes doing the bra up a little bit sore. That's the reason I took the sleep bra with me, but I discovered there was no difference whether I wore a normal bra or a sleep bra for that one. And that would have been the incision that they used to keep my liver out of the way. This one here was where the drain was, and that was the most source of pain when the drain was in there. This would have been the one where they pulled my stomach out with, and these two smaller ones would have been devices used to do the cutting and the splicing and the stitching. So I do have 1, 2, 3, 4, 5 incisions. They're currently covered with this plasticky stuff. And at the moment it's this that's kind of the source of the pain. And the pain is mainly due to actually movement. When I'm not moving, there's very, very little pain. The main source of the pain is my stomach jiggling, where all the incisions are. That's pretty much the only pain I'm getting. Unless I take too big of a sip of water, and that pain's minor. So another little thing to talk about, which is my uvula, which is the thing that hangs down at the back of your mouth. You know that thing when you say R, it goes backwards. That's why they get you to say R. They obviously would have intubated while I was in surgery, so they've put a tube into my lungs for my breathing. And they've obviously quite badly damaged it. They seem to have stretched it and it seems to be very, very swollen. So it's touching the back of my tongue. It feels like there's something constantly in the way at the back there. I'm trying desperately to ignore it because if I leave it in a certain position it can make me feel a bit nauseous. But I've looked in a mirror and it looks really bad. Like it looks very, very damaged. And kind of horrible. So that's actually probably the most annoying thing at the moment, actually. More annoying than the pain is the feeling of that uvula that's very badly damaged. But that will heal. Gradually the swelling will go more and more down and that'll be fine. Okay. If you have any questions about anything I've talked about in this video or any previous videos, please leave a comment below. And if you'd like to follow my journey a bit more closely, then please subscribe below. Thank you so much for watching. Bye.